Hello, my name is Dr. Caroline Peterson. I'm the Director for Cancer Screening and Prevention for Kettering Health Network, as well as an obstetrician and gynecologist. Our mission at Kettering Health Network is to make sure we provide the most up-to-date and individualized care for our patients. By utilizing the latest technology and evidence-based precision medicine, we were able to evaluate your personal and family history, and it was determined that you may be at an elevated risk of developing a hereditary cancer. It was also determined that you may benefit from genetic testing. Genetic testing is important to clarify whether there is a hereditary link to cancer in your family. The following video will cover several important topics to help you learn more about hereditary cancer and genetic testing. It will also help you and your physicians work together with Kettering Health Network's Cancer Prevention Center to make more informed decisions about your health care.
What is hereditary cancer? A common question when someone is diagnosed with cancer is, why did this happen? Most cancer is sporadic and happens by chance due to a combination of non-genetic factors like age, lifestyle, and environment. About 5 to 10% of cancer is hereditary, meaning it is due to a spelling error or a mutation in a gene. Genes are like a set of instructions that tell our bodies how to grow and function. Certain genes help protect us from developing cancer. However, some people are born with a spelling error in a cancer protection gene that causes that person to have an increased chance of developing certain types of cancer. This does not mean that a person will definitely get cancer. It just places them, and potentially their family members, at a higher than average risk. How do I know if I need genetic testing? Knowing your personal and family history of cancer is the first step. Both your mother and father's side of the family are important because we get half of our genes from each parent. Your healthcare provider already had you answer some questions about your personal and family history and identified one or more signs suggesting there could be a hereditary link to cancer in your family. Some of the signs we look for include cancer diagnosed at a young age, multiple family members with cancer, or a rare type of cancer. It is important to understand that having one or more of these signs in you or your family does not mean you have hereditary cancer. It just means that you may benefit from genetic testing. What is genetic testing and how can it help? We can use genetic testing to look for spelling errors or mutations in your genes that may increase you or your family members' risk of developing cancer. This can be done on a small sample of blood or saliva. If genetic testing determines that you have a hereditary risk for cancer, this will enable your healthcare providers to make the best possible plan for early detection and prevention. What type of results can I expect from genetic testing? There are 3 types of results from genetic testing. A negative result is the most common and means no harmful spelling errors were found in any of the genes tested. A positive result means you were found to have a spelling error in a gene that we know leads to an increased risk to develop certain types of cancers. With a positive result, your healthcare provider will be able to tell you more specific information about your cancer risks, medical management, and how this may impact your family. For example, potential changes to medical management for early detection and prevention of cancer could include earlier or more frequent screening, certain medications, or preventive surgery. The third possible result is called a variant of unknown significance, or VUS. This means a change was found that may or may not impact your cancer risks. This is not a positive result and should not be used to change your medical management. What are some common questions? You may have questions about genetic testing. Here are some common questions other patients have asked. Will insurance cover the cost of my test? At Ambry Genetics, our insurance contracts cover 95% of insured patients. 4 out of 5 patients pay nothing for testing, and the remaining individual has an average out-of-pocket cost of less than $100. We provide personalized verification of insurance coverage and financial options for genetic testing. If genetic testing is not covered by your insurance, low-cost options are also available. What if I have already undergone genetic testing? If it has been a while since you had genetic testing, you may want to talk with your healthcare provider to see if additional or more accurate testing is available, as there may be new genes or better technologies since the last time you were tested. Will my genetic test results be kept private? There are federal laws, such as GINA and HIPAA, that provide you protection. Some states have additional laws that protect you. How will genetic testing impact my family? If you have a positive result, some of your family members may also need genetic testing to determine their cancer risk. It is important that you share this information with them so that they can discuss with their healthcare providers and consider testing if needed. Now that you have learned about hereditary cancer and genetic testing, you can make more informed decisions about next steps with your healthcare team.